introduction. So my name is Dr. Sami. I'm CEO of Chicago Telluride. I'm an international medical graduate, just like yourselves, right? I was in your shoes 20-something years ago, did the U.S. Assemblies. I went to St. George's in Grenada, did the U.S. Assemblies, did my rotations in the U.S., and then, started my career in as a transitional year intern. Didn't want to do internal medicine. That was what I started off in, and I got into radiology, and then 3 years of practice in hospital radiology, and then I became a teleradiologist, and then never looked back after that. So part of my vision for people who want to go into medicine is not just to be employees, but also become entrepreneurs. And when we hire for radiologists in our practice, Chicago Telluride, and we have more than 20 radiologists working for us right now, like we look for people who are not just robots, right? Like, so I've worked with people who have had Harvard and Stanford pedigrees, and some of them, and many of them actually, in my opinion, have very average careers. When we see somebody who's actually graduated from an international medical school, like that actually shows, some initiative. Somebody's gone to a foreign country, or if you're coming from another country, you want to come to this country and work. It actually shows a lot of initiative, because it takes a lot of time, effort, and money to get into a U.S. residency and then be successful and then be practice. So mainly what I want to do is just answer you guys' questions and help guide you on your path and share with you the experiences and the knowledge that I've had, and hopefully you can benefit from that. So we'll open up the questions, and maybe Rhonda and Jen, just introduce yourself quick, and then we'll open up the questions. Yeah.
Yep. For those who don't know me already, I know I see some familiar faces here, but I'm Rhonda. I'm the COO here at Chicago Telluride, and anybody who comes through our externship program and our or elective rotation program, they'll be working with me and with Jennifer, who's here, and with Dr. Sami, obviously, and some of our other rads. So I'll hand it over to Jen to introduce herself.
Hi, everyone. I'm Jennifer Vakash. I'm the Senior Administrative Coordinator here. So I do a lot of admin work. I help assist Rhonda with all of our externs and just do a lot of administrative work here in the office.
Great. So Derek and Afak, if you turn on your videos, please, so we can be interactive here. I appreciate that. Yeah, so we know. Yes. Thank you. So let's open up for questions. Go ahead, guys. Ask us any questions about being an IMG, getting U.S. clinical experience, the process of getting a residency, anything that's on your mind, go ahead, ask us. You're muted, Derek. So we can't hear you.
I'm seeing if I can unmute him.
Oh, okay. You have a mute on our side?
Yeah.
Oh, got it. Oh, maybe everybody's muted.
No, everybody can just unmute themselves. It makes it a lot easier. So you don't have to mute on and off. Suraj, let's hear from Suraj, if I'm saying that correctly.
Yeah, hi.
Hi, welcome.
Welcome. Go ahead. Yes.
I listened to others' questions.
Okay. Go ahead, ask a question. Yeah. Somebody asked, well, where are you guys? What specialties are you guys applying for right now? Let's start with that. Just go ahead one by one.
I'm applying to IM.
IM, okay.
Yeah.
Hi there. I'm applying to internal medicine as well. So my question is it always necessary to do a sub-internship before applying to a program?
Like, what do you mean by a sub-internship? What does that mean to you?
Like doing an elective in a hospital before you apply to that program.
So are you talking about in the US, obviously, in the United States?
Yeah, exactly. Yeah. So by the way, I'm a Caribbean medical student. I'm currently doing my rotations in Michigan right now.
Oh, okay.
So I'm also looking for sub internship options.
which school and where are you doing your internship?
So
Or
I'm from
electives?
I'm from San Martin's University. It's
Mhm.
it's located in Curacao.
Okay,
So yeah, so I'm rotating in Michigan, mainly in Pontiac. So I'm looking to
at
apply
St.
for
Joe's?
internal medicine.
Are you doing it at St. Joe's in Pontiac?
No, there's like a hospital, Pontiac General Hospital. So
Mm.
we got few rotations over there and few in other clinics nearby in
Got it.
Pontiac.
Okay. I see.
Yeah.
I see. Yeah.
So
So
how in yeah.
yeah, how important is having internship? So the important thing is how much U.S. clinical experience are you getting to put on your CV, right? Because what they want to see is, have you spent any time in the U.S. medical system, whether that's in person or via remote rotation? I don't think that's as important unless you're doing like surgery or something more intensive where you have to see patients to do the rotation. But the idea of a sub internship is that they're giving you more clinical responsibility than just a rotation or an externship. As a foreign grad, it's going to be harder for you to get more responsibility unless you have that relationship with the residents and the attendings. I mean, when I did my rotations at St. Joe's in Pontiac, Michigan, actually. So the staff and the attendings were amazing. I mean, it's like after they got to know you for a few weeks, I mean, we were writing orders and doing things and managing patients, and the staff would co-sign, after. But a large amount of the care that was provided, like when I was on sub internships, I mean, it was just me and the other students, and the nurses got to know us, and it all depends on your relationship. So the short answer is you want to get as much U.S. clinical experience on your CV as possible before you apply. And it should be interesting clinical experience, right? It should be experience that you could talk about in the interview, because if you're just doing the same things that everybody else is doing, it doesn't really stand out that much. So, like for example, I did an elective in forensic pathology, and it was unique and strange enough that when I did my residency interviews, they asked me about it. It's like, forensic pathology, what was that about? I told them I shadowed a pathologist. He was a coroner. I did maybe like with the coroner, I did 40 autopsies in a month, and I would travel to small towns and we'd investigate murder scenes and suicides and train wrecks and and all kinds of stuff. And it led to 5-7 minutes of the interview being consumed of that, and that was memorable, right? Oh yeah, he's the guy that was that did the autopsies during his fourth year elective. So you want to have stuff that's memorable, that can distinguish you, that if you're going for a particular specialty like radiology, if you're applying for radiology, definitely do electives in radiology. We have a teleradiology externship that people from around the world do with us, and we'll talk about that more. But regardless of what specialty you go into, you definitely want a radiology externship on your CV, because they're going to look at that and they're going to be like, okay, tell us about your experience in radiology, in teleradiology. That's unusual. That's interesting. Not a lot of candidates are going to have that on their CV. So yeah, sub internship is great if you're going to be, actually managing patients closely. And if you get that experience, that's great. It implies you're having like you have more responsibility, but it all depends on your relationship. The title of the rotation doesn't really matter. It depends on how you relate with the residents and the attending staff and the program director. And the other thing I'll tell you is, if you can, give presentations during your electives, right? As a foreign medical graduate, you want to distinguish yourself. So if you're at rounds, whatever topic was discussed the day before, they'll often ask, like, okay, somebody tell us about whatever topic, like management of hypertension, right? So if you have like a little prep presentation, like 5 minutes at rounds, like, you're going to stand out, right? Because a lot of med students are just not going to do that. Like, I wasn't great at doing that myself. Like, I kind of coasted through most of my rotations, my core rotations. And it wasn't until my electives I was like, I actually should contribute more to this. So for me, that happened to be radiology. And I did like little presentations, and I did a major presentation at the end of my externship. So that helped me, that distinguished me a little bit. I put that on my CV, and I got a bunch of interviews in radiology. So that's a long-winded answer to your question. Right.
Does that
Anybody
answer your
else?
question?
That, yeah.
Yeah, it does kind of. So there's no point in doing a sub internship, but unless it's like a hands-on, much organized experience, right?
Yeah. Yeah. I mean, you want to, and if you do that, like you want to document on your CV exactly what you did. Like you don't get much space, but you want to like share that, you know, what level of responsibility you were given and whatnot. So you have two other participants. One is Dr. Janae Dawab. If you could turn on your videos, please, because everybody else has put the videos on as well. So I appreciate that. All right. Any other questions for anybody else? Other questions? I'm sure you got questions.
It can be anything, like even if it's, you think
Yeah.
it's something.
What are you guys,
or
what are you guys
silly.
doing for US clinical experience right now?
So, hi, everybody. My name's Jeremy.
Hi,
Hey,
Jeremy.
I'm at AUIS. I'm going to be applying to IM and family medicine, but I really want family medicine. Geographic location's important to me. I'm going to be applying to everything around Georgia where I live. This is a second career. I was an acupuncturist for 15 years. And so I guess my question is, how important is step 2 CK score versus US clinical experience? And US clinical experience is going to be just all my rotations from my school, plus my previous history as an acupuncturist. I don't know if that is helpful at all.
Probably not realistically, right? Because whoever's hiring for a residency position, they're hiring you for that particular job. Like, so, I mean, my knee-jerk reaction is acupuncture is probably not that valuable. However, it depends on the program you're going to. So if there's more of a holistic approach and the program director and the attendings happen to be into those kind of things, then maybe that does play, you know, a valuable role. Or if you're going to anesthesia, you know, if you're applying to anesthesia, maybe that's an interesting thing, because I know they use acupuncture in anesthesia and pain management. So that's something to consider, like as a subspecialty in family medicine, is pain management. A lot of anesthesiologists go into that, pulmonologist goes into that, but that could be an interesting angle on your family practice application, that you're interested in family medicine. However, as an expert acupuncturist, you have an interest in dealing with chronic pain, right? So I take my answer back. I think you could actually roll that into something really positive on your application. Say that you have an interest in pain, right? So, which is not very well addressed in the US medical system. Like we just went through an opioid epidemic, and there was, you know, all these lawsuits and payouts by pharmacy companies and whatnot. But acupuncture, I think, would be something that should be looked at for people with different kinds of pain. So yeah, I would definitely play that card and add that to your CV, and you know, and show them how you would incorporate that into your work as a resident. No, but I think your question is about scores as well, right?
Well, yeah, step 2 CK score versus clinical experience. Is any one more important? And then also, is my clinical experience at my medical school going to be enough to obtain a residency?
Yeah, so scores is basically a screening mechanism to who they want to bring in for interviews. So you're going to have high scores, right? If you don't have high scores, that's the easy route to get to an interview. Have high scores, right? So if that means you have to prep a year and study for step 1 and step 2 and step 3, by the way, get step 3 out if you can at all costs. Get it done with before you get into residency. But having high scores will make it easier for you to get into residency. But you could have 99th percentile on your scores, but if you got nothing interesting on your CV, you may not get an interview. You probably get an interview, but they're going to be like, well, this is a robot, you know, coming. Like, what's distinguishing you from everybody else? So the easy path is high scores. But if you don't have high scores, then distinguishing yourself on your CV, because they're hiring you for your job, right? Which is the function of an intern, a resident. And is your medical school rotations enough? Is that what you're saying? I mean, they should be. right? Like, are you asking, is it enough to apply for residency, or is it enough to
Like, should I
practice?
be thinking about doing additional US clinical experience?
It depends if you're applying this year or not. Like, if you're applying
I
this
want to
year,
apply this year.
yeah, I would do as much as you can through the application cycle, apply, and then wait to see what happens on the match,
Okay.
right? If you don't match, then you want to add more USCE to your CV. But I wouldn't not apply and then try to get more clinical experience. I don't think that's helpful. Like, I think you should apply with whatever you got, right? Make it look as best as you can, get feedback from program directors as much as you can, right? It's not unfair to ask them, like, where do you think you're going to rank me? Do you think we're going to rank high, after this interview? Like, that's not unfair. I don't think. I would ask program directors, what's the chances of me actually getting to this residency? And they tell me, it's high, low, medium, I don't know. Or, that's not something we talk about. It's like, don't be afraid of what people are gonna say, right? Like interesting story. Like I actually didn't apply through the match for radiology. I started in transitional year, and my idea was to go into internal medicine, but I was on call for my ICU rotation, and it was supposed to be relieved Friday. It was Thanksgiving, the Friday after Thanksgiving, and whoever was supposed to relieve me, she couldn't get in. Her flight got canceled. There's a snowstorm, blah, blah, blah. I told my chief resident, like, hey, I've been working 36 hours. He's like, what do you want me to do about it? I'm like, well, isn't there like a law or something where I can't work more than, I'm exhausted. I can't keep managing, ICU patients like as an intern. Like, and they're like, well, I can't help you. I called the program director, and he told me, well, can't help you either. You're out of luck. You're going to stay until your relief comes in. My relief didn't come until Saturday. So I've been working like 40 hours, which, it was exhausting for the ICU. And I was like, that Monday, I pulled out the green book. I'm done with internal medicine. I basically just started calling every single program director in radiology I could Monday morning. And I did that all the way through. And it was like 130 programs at the time. I think I called about 95 of them. And I got everything from, who the hell are you? I had program directors paged overhead back then, page to the operator. I got a lot of negative responses. I got a bunch of hangouts, but I had 20 program directors I had interesting conversations with. And they said, okay, well, you know what? Let's send in your information, and I wanna bring you in for an interview. So I probably had, out of the 20 who expressed they wanted to have me for an interview, I probably had about 11 interviews, mostly in the Chicago area. This is where I wanted to be. And out of the 11 interviews, I got 5 offers outside the match, right? One of them right at the interview. I even got an offer right at the interview at the University of Minnesota, which is a great program. So never be afraid to just make the call, don't care what people think, right? Like, the worst they can say is no. So I would take that to every stage of your medical career. Like, if you see anything, just ask them for it. Like, don't be afraid of what they're gonna say, because it never should stop you. And I hold that true right now too. Like, we have client calls, and we'll sometimes put ridiculous demands on client, like, ridiculous hourly rates, or we're not going to read these type of studies, or we're not going to do weekends or whatever. And the worst they can say is no. So I would say, as an IMG, like, play all your cards to your advantage. So the acupuncture thing, heck yeah, roll that in there. Tell them how you're going to be an amazing family practitioner who can solve their patient's pain through acupuncture as well. I'd be interested as a program director to interview on that.
Thank you.
Yeah. What else? I'm sure other people. Hey, the people who don't have their videos on, can you put your videos on? Junaid Nawab, Arindam Pol, Ari. Hey, Ari's here. And there's somebody named Tanushri, and then somebody.
I'm working, so I cannot.
Oh, okay, no worries. Yeah, no worries. Somebody in Russian.
Dr. Junaid, his camera isn't working apparently.
Oh, okay, that's okay. That's fine.
Hello, Dr.
Yeah.
Sami. Yeah.
Go ahead.
My
Hi.
question. Oh.
How are you? Yeah,
Go
you
ahead.
can. You can go ahead,
Asado,
please.
and then whoever the next person is. Yeah.
I had a question about I am a Caribbean med student in
Yeah.
4th year right now in St. Martin's University as well.
Okay.
I rotate in Michigan right now.
Yeah.
So I wanted to apply for IM this year, and I didn't have any opportunity for any research. So how important is research publications for IM residency?
Yeah, it depends on what program you want to go to. If you want to go to academic program, maybe more so, because the attendings that are rotating there and teaching there, they may be interested in particular areas of research. But if you're talking about applying to IMG friendly programs, I mean, those attendings are not doing research, right? The community hospitals, they're really more interested in what are you like as a person? Can they rely on you? Can they trust you? Do you have the intellectual capacity to handle the cases? Do you have the physical and mental capacity to do the work? Those things I think are more important. Like, and then what extra do you bring to the program? Do you have some unique skill set? Like acupuncture, that's a unique skill set. Have you done jungle medicine where you treated, you know, toxoplasmosis in babies, you know, in the middle of the Congo? I mean, I don't know, like if you have something weird and unique that nobody else really has, that you're gonna, you know, maybe be an asset to the program, they're gonna look at that more than research, I think. I think research is kind of like again, my opinion, I could be wrong, but more of an old concept that research helps you get into residency. The thought back then was that you did research with some attending who had some sway with the program director, and they'd be like, hey, this person's been working with me for a year. They show up on time, they smell clean, you know, they give good presentations, they're reliable. You want to consider this person for a resident, right? That was the idea, but somebody just looking at a CV and seeing that you did 4 research projects, I don't know that that holds a lot of sway with a IMG friendly program director.
And also, you were saying that we can ask the program, like if I get an interview for IM, like is that okay to ask the program director like how they feel about me, or are they gonna see
It
me in the
depends on
lab?
how the interview goes, right? Like, so if you're very robotic in your interview and you just give canned responses, and that level of nervousness also translates to the program director, they're going to be nervous about giving you honest feedback. But if you're easy to talk about you're easy to get along with, you know, you make small talk, you have humor, and you have the emotional intelligence to connect with somebody, you could, you know, in a moment of you know, kind of levity, you could just ask them, hey, what do you think my chances are? You know, like an open-ended question like that. So you kind of have to play it by ear. Like if it's some stodgy, you know, person who is very rigid and principled and whatnot, they may not appreciate. But if the person is like easy to get along with and they're jibing with you, ask them, hey, what are my chances realistically? You know, that's exactly what I said. One guy said, at the University of Minnesota, the chairman of the department, the program director were in the same room. I just told them at the end of it, hey, what are my chances realistically? And they're like, hey, you got the job if you want it right now. Here's a contract. It literally took me just asking. If I didn't ask, I'd go back, you know, maybe they'd send me a letter, maybe I accept somebody else. But the guy just said, hey, if you want the job, it's yours right now. So you have to, but I felt enough of a vibe with them that I could ask that question. So you'll have to judge that.
And also you said about calling the program director. Like, are we allowed to call them, or if we can, how do we try to contact them to get an interview? Or
Yeah, it depends if you're calling during the match or outside the match. Okay, so back then when I did everything, I mean, there was no internet and there was no ERAS and this is ancient times. It was all paper applications. So it was considered outside of the match. Offers were made all the time back then, right? You'd apply. We did have a match outside the match application, and you had to wait for a letter to come in the mail. Outside the match applications or offers happen all the time back there. I think now there's like some rules around that, like they can't offer positions outside the match. However, let's say you did a prelim year, right? And you don't have another year to go to somewhere else, by all means, call every single program director you can to find that second year, right? Or if you're in a residency a year, a program that you're not really liking for whatever reason, call the program directors. I mean, they're human beings just like yourselves, right? And so again, some people are very rigid, some people are very relaxed, and you just never know. But if you call 100, I promise you 5 or 10 of them are probably going to want to talk to you. Or you'll be like, hey, thanks for calling, you know? Oh yeah, okay, I like your story. Send me your information. Let's talk more. Like a 5% response rate is actually a great response rate. So, but don't
So
be
I just want to speak to that a
Yeah.
little bit too. One of my closest friends from medical school, when she didn't match, it took her actually, I think like 3 years, 3 tries to match. And I mean, she had really great scores and everything. I just wasn't her time apparently. But what she did is get better at identifying programs that had unfilled spots. So, and then she compared who was accepted versus her when it came down to the last 2 spots the next year. And so then she spent the entire course of the following year developing a relationship with the program director. So she communicated back and forth, said, you know, I've done this, now I've done step 3, here's my step 3 scores. And they just developed a good working relationship over the course of the next year. Then the next match, she applied and she's already done with her residency and she went to LSU, which is a great program. So, and she finished residency in family medicine and heavy in OB/GYN aspect of family medicine. So that's another good thing to do, is to just develop those relationships based on open spots that, because believe it or not, there are spots that go unfilled every single year. And so you got to search out those spots that fit your program and your location of where you want. Like for her, she was willing to go, you know, anywhere. So she wasn't tied to any specific location. So that's another route that you can go to.
Yeah. Yeah, it's not a bad option actually. If you're especially a place you did rotations, like just investing the time to get to know the attendings really well, volunteering to give like talks on particular topics. That always is a crowd pleaser. Like you will always get great reviews if you volunteer to give presentations at a residency program, because it shows a lot of initiative. I wasn't back in residency myself. I wasn't like really a talker or a presentation giver or whatnot, which was a missed opportunity. Even as a med student, I kind of coasted through, and it wasn't until my 4th year, like, and it really hit home in radiology, where I was first I was genuinely interested in everything. And then I was like, okay, I volunteered to give talks on ultrasound and on neuro MRI and whatnot. And that got me a lot of like good letters of recommendation. And I was able to capitalize on that when I went on interviews, and we'd talk about that during the radiology interviews. So, but yeah, that's to Rhonda's point. I mean, I think that's really a good way to get into a program, is to invest time into a particular program, maybe 2 programs in a geographic area, get to know them really well, and see about, you know, getting a spot there.
I had one more question that
Yes.
we right now we rotate in Pontiac General Hospital, and we did one rotation in St. Joe's as well in Michigan.
Yeah.
And we did our rotations in clinics as well, like private clinics where we go to see the patient. So when we ask for the LOR, letter of recommendations, is there a difference where a doctor who does private practice, whereas or somebody who does in a hospital, does that make any difference for us? Or
Yeah, I think like the old thinking used to be that you would want to get a letter of recommendation on the hospital letterhead. This is like a big thing back in the day. Somehow the thinking is that it adds a little level of credibility. I think now not so much. It's fine to have it on letterhead from a private clinic. I don't think there's anything wrong with that. It depends on who the letter of recommendation is coming from. So if it's somebody like the program director, like in an academic setting, maybe it carries a little bit more weight. The letterhead doesn't matter as much. If it's somebody from a research program, heavy in academics, and the program director is interested in that kind of research, maybe it has some more weight. I can tell you in teleradiology, in radiology applications, like when people apply for radiology residency and they've done a teleradiology rotation with us, the program director is oftentimes thinking about eventually going into teleradiology. I'm like, okay, tell me about your experience. How is that? And I've actually had program directors and attendings at hospitals in radiology contact us because say, hey, we interviewed this person, they rotated. Tell me more about radiology. How's it teleradiology going for you? How did you get started? All that kind of stuff, right? So for those wanting to go into radiology, or even if you're not going into radiology, like doing a teleradiology externship can add something that distinguishes you from everybody else, because radiology is a big part of what you're going to be doing, regardless of what specialty you go into. So yeah, I mean, I think the question was the hospital. Say it again, your question.
Like, is there any difference if we get LOR from a doctor who does private practice versus who works in a hospital?
I don't think so. I don't really think so. Not so much. No. Whoever, if they're really interested in you, they're gonna Google who the LOR is coming from. And if that person has a successful multi-specialty clinic practice and there's a bunch of physicians working under them and whatnot, that letter of recommendation is going to carry more weight as opposed to like somebody who has their own clinic and it's just them and they have 0 LinkedIn followers and no presence on the internet and they have nothing. Like that LOR is not going to carry much weight, right? As opposed to a professor of medicine who specializes in aldosterone, like they know everything about that and they write a letter of recommendation. Obviously they're going to look at these things, right? So, you know, private practice who's got a thriving practice, who, you know, taught you a lot and has a great presence on the internet will carry more weight than just somebody who's not on the internet at all, has no presence and just has a tiny clinic somewhere and nothing else. So be careful who you get letters of recommendation from is the message. Yeah. You want letters of recommendation from people who have a substantial presence, who can recommend you, and their weight carries some their recommendation carries some weight.
Okay, thank you.
Yeah. Sure.
I think
Anyone
Asado
else?
had a question.
Yeah, go
Yes,
ahead.
yes, I did. Yes. So for me, I'm actually applying for the alternative board of radiology pathway. So I'm applying for fellowships. But I've spoken with a few friends who have also advised that I should also apply for residency. And so specifically, actually, he told me that I should apply for radiation oncology because they've had lots of unfilled spots over the past few years. And I just wanted to know why this is the case. Is there something about the job market that makes radiation oncology less what now?
Yeah.
Appealing.
At the moment.
Yeah,
Exactly.
I have several friends who are radiation oncologists. They do very well. I'm surprised that there's less people, you know, going into it. I mean, you have banker's hours, right? You don't have any life and death concerns. It's pretty much all outpatient. It could be the nature of the work. I'm not sure. I'll have to ask my radiation oncologist friends. Were there a lot of unmatched positions in radiation oncology? It's a great field, by the way, in terms of career success and all that. Were there a lot of unmatched positions?
Yeah, so that's what he told me, that there have been lots of unmatched positions
I
in
would
the
check the
last
data.
3 years, I think.
Did you verify that from the NRMP or did you just hear
Oh,
that?
yeah, there's lots of soaps in
Radiation oncology, I mean,
I think diagnostic is a bit more competitive at the moment.
yeah.
Residency.
Yeah, radiation, I mean, it's a great specialty to go into in terms of career, income, and lifestyle. I mean, if that's what interests you, right? Like, I mean, it's a great option. I wouldn't hesitate that. Nuclear medicine, less likely. Like nuclear medicine is a really tough time getting work. I mean, there are dedicated, you get limited. I think that may be the limiting factor of radiation oncology. It's still an on-site job, is what it is. Radiologies can be teleradiology, can be off-site, right? So all the younger people want to be working from home in their pajamas over the internet now. So Nobody wants to go into the hospital anymore.
Yeah.
And so that's why you may see, you know, the traditional specialties maybe getting less, but still, I mean, I think, you know, compared to surgery, your internal medicine, radiation oncology is amazing in terms of income and hours, right? Yeah, so I'd definitely go for it if you can. Yeah, if that's what you want to do. Yeah. Yeah. I think there's a question. Tanushree, you have a question? Is it? If you want to
Hello.
just unmute yourself, Tanushree. You're muted. Oh, there you go.
So I'm currently a radiology resident, final year in India,
Mm-hmm.
and I was planning to give the steps and to apply for a radiology residency or via the ABR pathway. So one thing I wanted to know, does a home country residency help? And second thing, how can we go about getting rotations in
Yeah.
radiology?
So home country residency, huge help if you want to go into radiology. Radiology is basically another language, essentially another completely separate from medicine. So if you're applying from a foreign country as a radiologist, you're probably going to have a better chance getting into radiology residency than somebody who's just a fourth year medical student from a foreign country. Maybe not so much from the Caribbean medical graduates, but if you're just applying from India just as a medical graduate, you may not have as good a chance as if you're a radiology resident or radiology graduate, because at least they know that you have the basic substrate to be able to do the work. Again, it comes down to doing the work, and you're going to be able to do the work the first year. So you're going to stand out. So then the question is, what were your step 1, step 2, step 3 scores like? As long as they're decent, you stand a pretty good chance of getting an interview. Fifth pathway is another good option too. So if you want to look at fifth pathway, I would, I think if you want to do, I can advise you about teleradiology. Like if you want to do teleradiology, like I wouldn't do a nuclear medicine fellowship. I wouldn't really do interventional radiology. Everything else is good. Like do body imaging. That's great. Emergency fellowship, if you can get it. There's a few of those out there. Neuro is amazing for that. So I'd probably do, if I had to do a fifth pathway and do fellowships, I would do probably in order of priority. I'd probably do body imaging, neuro, MSK, and maybe peds in that order.
So
Do four anyway. Oh no, I
Yeah,
was just saying you have to do 4.
4. Yeah.
And then as far as getting like you asked about a radiology like rotation for US clinical experience. I mean, there's definitely resources. We're one of them. You know, we offer an externship program or rotations. And so we definitely have resources that way. And then on top of it, you know, once you've successfully like completed our program, you know, you have the opportunity to become one of our teleradiology scribes. So then that builds up more experience with our other radiologists here. So that's more letters of recommendation, everything. We have one of our former students right now. He's in training to be a scribe because he wants to go into radiology. So he wants to get the more exposure, more experience, and you know, work with a bunch of different rads. So
yeah, you definitely want to do a teleradiology externship with us if you're looking to do if you're looking to apply to US radiology residencies. But any specialty you're looking to apply to, I would highly recommend all of you do a teleradiology externship with us, because we had a student went and applied for surgery. He got into a surgery residency and he was a scribe with us for a year or two. And he said when he got into a surgery residency, he could look at CT scans, and he was teaching the first and second and third year surgery residents how to read CT scans and ultrasounds and plain films, because he had done so much radiology just scribing with us as in his gap year. He applied 1 year and then he didn't get in, and then he had a gap year. So he filled it up with working for us as a teleradiology scribe, learned a ton of radiology, went on his interviews, talked a lot about radiology during his interviews, and he matched actually, so in Southern California. So a great way to put experience is to do an externship with us. And again, you can do it remotely. So We also give letters of recommendation. So especially for radiology, I sometimes get calls from program directors. Hey, what do you think about this candidate? You know, then it goes into tell me about teleradiology. Like I'm thinking of maybe when I leave here, I'm going to do teleradiology and get a house in Florida or work from Hawaii or something like that. And then we have a conversation about that. So. Does that answer your question, Tanushree? Yeah.
Yes, sir.
Yes. Okay, great. What else? We have 15 more minutes. What other questions do we have?
Hello, Dr. Sami.
Yes, hi, Afak. Yes.
Yeah, how are you doing?
Good. How are you? Good, good.
Yeah, I'm good. So, my question is related to the previous two questions. So, I am a working radiologist. Actually, did my residency in Pakistan and qualified there. And parallel there is the qualification of EDIR and FRCR is also in process. So currently I'm working as a radiologist in Saudi Arabia. So my question is, if I start this USMLE process from now, so it's a kind of a little lengthy because working in radiology for quite some years, then going back to the basics and all that. So is it worth doing, and how likely is it possible that I'm going to get the residency match, or in case the fellowship programs? So having more than 3 years of experience after doing the basic postgraduate qualification. So when I'm done with the MLE, like if I start from here and finish after like 1.5 years, and so how is the job market there? How much is the saturation of the job currently there? And the current impact of AI in the radiology. So is it all worth doing at this stage, because this it's like starting from zero, going back to the histology and pathology and all that, and the basics of the medicals. And so once I'm done with the MLE, then when I come in the market, so the jobs are very few or something, because the impact of AI, everybody nowadays talks about this AI very much. So I would need your just little feedback and the recommendations. So is it
what's the average salary of a radiologist where you're at right now a year?
So yeah, it's in Middle East it's a little high, like $5,000 or 6,000, but in home country like Pakistan it's very very less. So I don't know, is because in the Middle East there is very much saturation in the job market currently. A lot of radiologists.
Say in Pakistan maybe you make $25,000 a year, and maybe in the Middle East you're making $50,000 a year, right? Average, is that about average?
Yeah, maybe less than 25,000 in Pakistan. So to be honest, yeah.
To be honest, so you know what the average salary of a radiologist here is in the United States? Any idea?
No idea exactly.
Okay, it's $500,000.
So it's quite high.
So do you think it's worth it?
Yeah, definitely worth it. But you are doing teleradiology and definitely a CEO. So how do you see the job market after 2.5 years? Or
we can't find radiologists right now. We have a lot of, if you look at a lot of my YouTube channel and LinkedIn, my number one priority is hiring radiologists. Like we do calls with radiologists every day, just trying to hire them. Like there's a shortage of radiologists right now. Like I could hire 10 radiologists right now and put them all to work. Like we have that much work on our hands right now. Yeah. Even some of our students who did teleradiology externship with us are in radiology residency right now. I told them, like, as soon as they finish, they need to come work with us. And they said, yes, they're going to do that. Right. And like, like compared, just reality check, right? Compared to where you are and what could be a potential here, it's like winning the lottery, right? I mean, you have like lottery-like returns, like 10x the returns from where you're at. That's not the only reason to do it, right? Understand that there's a lot more hurdles in your way. You're going to have to put a lot of blood, sweat, and tears to pass the USMLEs, to go through the applications, to go to interviews, to do all that. Like you may invest significant dollars to do that, but is it worth it to go from 50,000 years to $500,000 a year? I mean, yes, depending on your goals, right? So obviously you got to work for that. Like it's not easy. Like it doesn't come easy here either. You're gonna have to work, but I mean, with work comes reward. And there's radiologists. My honest opinion right now is radiologists are not working as hard as they could be right now, right? But they're also getting burned out more. So I have radiologists I hire that work 7 days on, 7 days off, and we also hire radiologists that are working 7 days on and 14 days off. They're only working 17 days, 17 weeks out of the year. And you wonder, why would they take 34 weeks off if they could make so much money doing just working? Well, they're choosing other things, like they're not, so that leaves more opportunity for other radiologists. Like I know some radiologists who work 50 weeks out of the year and make a ridiculously high income, more than that, close to 7 figures. And why are they doing that? They choose to do that. That's what's important to them now. They're accumulating capital so they can put in investments that'll generate passive income that they can retire early. So some people are doing that, right? So it depends on what your goals are and what you want to do. So
can I just find out about the telerad? Do you have to be ABR certified to teleradiology?
Yes, you do.
Okay.
Yeah.
If you have the FRCR, you can't.
No. You got to have US. You got to be licensed in the United States to do teleradiology in the United States. You can't do it without a medical license. That means passing the USMLE exams, doing residency, getting your ABR board certification to do work in the United States.
Because the folks that do teleradiology for us in the UK, I think they all live in Australia, actually.
Mm-hmm. Yeah,
And
there's
so-
a lot of cross-border teleradiology that happens. Yeah. Definitely.
We have a question from Dr. Junaid. I think Jenny's going to
Yes.
ask it. He put
Go
it in
ahead.
the chat. And then Dr. Ari Paul has a question after that.
Sure. Go ahead.
Okay, so Dr. Junaid says, currently I'm doing medical coding and prepping for steps, and I want to pursue family medicine in US and want to know how much a 1-year WHO endorsed regional diploma in family medicine would help my application.
What was it? Dr. Jane's mic not working or something?
He
He's at
says
work.
he's at work.
Oh, okay.
Mhm.
No
Yeah.
worries. So let me look at this.
Yeah, there's a little background there too.
There's a
You can see it.
background. Okay. Medical coding, preparing for steps. And 1-year WHO original. Probably not much is the reality. So your question is, how much can a 1-year WHO endorsed regional diploma in family medicine help? The reality is not much. Like, I don't even know what that is, to be honest with you. Like, it's just another year of family medicine training, but I don't know what WHO endorsed means. Yeah, and then the rest of medical coding, I don't think that's going to help. You're just going to have to get really high scores on the USMLE, distinguish yourself, on your CV with your experience, and apply, right? That's what you're gonna have to do. That's what it's gonna come down to. Yeah.
And then Dr. Ari.
Yeah, Ari, go ahead.
Okay, so I have a question regarding the CV actually. How much the extracurricular activities weigh on your CV?
How much do they matter, or how much should you include?
Yeah, how much does it matter?
Like what extracurricular activities would you include?
Like as in sports, like
Probably not much. Like everybody puts on sports, cooking, and traveling. Like those, everybody puts that on there, right? That
okay.
doesn't mean anything.
No, because I play for New York League and I won many awards too. So like I
You
was
play
gonna
for New
ask,
York
like, if
League?
that can, yeah, I've been playing since 2019 for New York League and I won many awards for it, like in it. So like I was thinking to put that on my CV so if it could help, because like being an old IMG, I want to make sure like I put like I can like I should try whatever I can to make my CV stronger.
Yeah, no, yeah, you blipped out there for me. New York League is what?
It's a cricket league.
Oh, a cricket team.
Yeah.
Oh, in India. Okay, got it.
No, in the US.
Oh, in the US? Yeah.
Yes.
You could put it on there. I mean, it's, you know, it might not get much notice. I don't know. However, if you're like if you were on America's Top Chef and you won like second place, cooking salmon, you know, over pasta, like include that, right? Something like that. Like if you got an award, if you were on the Indian national team for cricket and you know you made a century, include that, you know. But short of
No,
that,
I have many home side award certificates as well as like awards from US too. So I was thinking to put that on my CV because apart from my astrophotography, I don't have any other extracurricular activities to put on CV.
yeah, they're probably not very interested in much of that at all. As you know, I mean, they're probably, you know, I mean, who knows? I don't know. Like maybe they share you get a program director that loves playing cricket. I would throw whatever on there you think is reasonable, but give it very short space. Like don't take 2 pages of your extracurricular activities. They'll get upset at that. Like I would put like maybe 3 lines of what your extracurricular activities are, not more than that.
Okay.
Yeah.
Okay.
Yeah.
Thank
You
you.
playing this year, Ari? Are you playing?
Next year, I'm caught up with a lot of personal work. Next
Are you
year,
here?
next year is the final.
Yeah, are you here in the US or are you in India right now?
No, in India right now.
No, in India. Okay.
But you're already starting your master's program too at Rutgers this year.
Yeah, I matched in Rutgers, but no, I have matched in many institutes. I got a call from Cornell too, but let's see. I've asked for some extension because like I've got up with a lot of personal work.
Yeah. By the way, just Ari is a former student of ours from 2 years ago. He rotated with me, and then he also came to RSNA and met with us at our booth there. And so Ari's a good guy. He's a very smart radiologist, actually. So
Yeah, and from time to time he does he hosts some of the meetings like this that we do and does some teaching sessions for people who are interested. So hopefully
very smart
we'll have
radiologist. Yes,
more
great
of
cases
those.
from India. Yeah.
Mhm.
He shares with
I'll be
us.
there again this year too. RNSA. I'm presenting a paper, hopefully.
Oh, at RSNA?
Oh,
Okay, good.
awesome.
Definitely
Wow.
come by.
Okay, we'll see you then. RSNA again.
See you there.
Anyone else have any questions? We have 3 minutes left. Anything else that we can answer in 3 minutes?
And we have these sessions every week. So, you know, different things come up every single week. So it's really just a big open dialogue to help everybody out. So any new questions you think of, you know, you can jot them down and join again next week. Or any good advice that you've had from, you know, any of your colleagues and what they've seen along the way too. So
yeah.
Tanushree, you can go ahead and ask your question.
Yeah, go ahead.
Yeah, so just one last question. When they mean research, so do they want proper statistical research like prospective and retrospective studies and meta-analysis, or do case studies and case reviews also suffice?
I mean, something is better than nothing. Like case studies are good, but I mean, if you have research that you've done, I would document that on your CV, whatever you've done, right? If you've done any research, like don't worry about the type of it. Maybe case studies I wouldn't put on CV because, you know, residents do those. I mean, the medical students do those. I mean, unless you've presented, you know, at a meeting, at a national meeting, you know, just putting case studies is not going to be helpful, but put any research you've done, any presentations at national meetings, that's always, you know, interesting. You put on there. Yeah.
Thank you.
All right. Sure.
go ahead, Ari.
All right. Last one. Yeah.
So, Dr. Sammy, like I have also won many awards and certificates for international paper presentations. So,
You have, I remember.
like, should I put that on my CV too? Like, would
Yes.
like how much that would matter?
Put that on there. Yeah. We should look at RECV, you guys, and have it formatted. Send it to Jen.
I'll put that in the group. Should I put that in the group?
Just send it.
in there.
Just send
Put
it
everything
to
to
send
them.
it to me, and I'll get it to Jen, and I'll have and send me in WhatsApp your most current
Okay.
professional picture, and we'll reformat your
We'll
CV for you.
reformat your CV.
Sure.
Yeah, just send
No,
everything.
I've
you've done.
recently reformatted it. I've recently reformatted it like according to like US system and everything. It's like they're concised in a 2-page CV, but most of them want in 1 page, and I couldn't fit it in 1 page. It's still my CV is still in like
yeah.
long in 2 pages.
Yeah, just
So
get it
I'll
to us
share
and
I'll
we'll
share it with
we'll
Rhonda.
redo it, and you'll have
Okay.
an extra copy of it in
Yeah.
this updated format that we do for all the hospitals. So
Yeah,
A
just
lot
send
of
it to
our,
me.
yeah, a lot of our radiologists have 2-page CVs.
Mhm.
Yeah.
yeah. So,
Yeah.
well, we do have to end this meeting because we have our externship meeting now right after this. So if anybody wants to rejoin again next week, that would be awesome. And I just personally want to say thank you to everybody for joining today.
Yeah.
And if
Thank
anybody
you. Guys,
wants to
good
hear
luck.
about our externship program, you can message us at support@chicagotellerad.com.
As
Yep.
well as the ones who have reached out to me directly during this meeting. And I gave you my email address and Jennifer's email address.
Okay, thank you guys. Thank you very much.
Thanks, everyone.
Okay.